Ever wondered why some women experience heavier menstrual bleeding than others? It's a question that's crossed the minds of many. Today, we're tackling a topic that's more common than you might think: excess menses. You see, the world of menstruation is as diverse as the women who experience it. From light flows to heavy, it varies significantly. So, it's time to shed some light on this prevalent issue and truly understand what it means. Let's delve into what exactly is excess menses. Excess menses, also known as menorrhagia, is a medical condition characterized by heavy or extended menstrual bleeding. But what does that really mean? To fully grasp this, we need to understand what's considered normal when it comes to menstrual bleeding, and how normal can differ from person to person. In general, a menstrual cycle spans about 28 days, give or take 7 days. This cycle initiates menstrual bleeding, or a period, which typically lasts anywhere from 3 to 7 days. The amount of blood lost during a period varies widely among women, but on average it's about 2 to 3 tablespoons. Now, you might be wondering, if normal varies so much, how can we define excess? Well, excess menses or menorrhagia is when the bleeding is so heavy or long-lasting that it disrupts a woman's normal activities. This could mean soaking through 1 or more sanitary pads or tampons every hour for several consecutive hours, or menstrual bleeding that lasts longer than 7 days. Another way to identify excess menses is by the amount of blood lost. If a woman loses more than about 3 tablespoons of blood during her period, or if she passes clots the size of a quarter or larger, it could be an indication of menorrhagia. It's also important to note that excess menses isn't just about the physical aspects of heavy bleeding. It can also have emotional and psychological effects, such as causing stress or anxiety about bleeding through clothing, or even leading to social isolation due to fear of an accident. Excess menses can occur at any age, but it's most commonly seen in women who are approaching menopause or who have just started menstruating. With all this information in mind, it's clear that excess menses is more than just heavy periods. It's a medical condition that can significantly impact a woman's life. Now that we have a basic understanding of what excess menses is, it's time to look at its causes. There are several reasons why a woman may experience excess menses. One of the most common causes is hormonal imbalance. Hormones regulate the menstrual cycle, and when they are out of balance, it can lead to heavier or longer periods. This imbalance can be due to various factors such as stress, weight fluctuations, or certain medical conditions like polycystic ovary syndrome. Next up, we have uterine fibroids, which are non-cancerous growths in the uterus. These can cause heavier than normal periods. They are fairly common, and while they can be uncomfortable, they are usually not dangerous. Then there are polyps, which are small, benign growths on the lining of the uterus. Like fibroids, they can also cause heavier periods. However, unlike fibroids, polyps are often caused by high levels of estrogen. Moving on, we have a condition called adenomyosis, where the endometrial tissue, which normally lines the uterus, grows into the muscular wall of the uterus. This can cause painful, heavy periods. The usage of intrauterine devices, commonly known as IUDs, can also lead to heavier periods, especially during the first few months after insertion. This is because the IUD can irritate the lining of the uterus, causing it to shed more than usual. Certain medications, such as anticoagulants or anti-inflammatory drugs, can also cause excess menses. These drugs can interfere with the body's natural clotting process, leading to heavier bleeding. Lastly, other medical conditions like endometriosis or pelvic inflammatory disease can also cause excess menses. In these cases, the heavy bleeding is often accompanied by other symptoms, like pain or discomfort. In a nutshell, there are a myriad of reasons why a woman could be experiencing excess menses, ranging from hormonal imbalances to the use of certain medications or devices. Each cause has its unique set of characteristics, which is why it's important to consult a healthcare professional if you're experiencing heavy periods. Identifying the cause is crucial for managing this condition. Now, let's move on to the symptoms. How do you know if you are experiencing excess menses? There are some telltale symptoms. It's important to remember that every woman's menstrual cycle is different, so variations are completely normal. However, there are certain signs that may indicate you're dealing with more than just a heavy flow. One of the most common symptoms of excess menses is soaking through one or more sanitary pads or tampons every hour for several consecutive hours. If you find yourself constantly needing to change your sanitary protection, it could be a sign of excess menses. Another symptom is having to use double sanitary protection to control your menstrual flow. This means using 2 pads or a tampon and a pad at the same time. If this is a regular occurrence for you, it's a clear signal that your period is heavier than normal. In addition, if your menstrual periods are lasting more than a week, this could also be an indication of excess menses. Most menstrual cycles last between 3 to 7 days, so anything beyond this range might be a cause for concern. Other symptoms can include passing large blood clots, severe cramps, or even symptoms of anemia like fatigue or shortness of breath. Being aware of these symptoms can help in early detection and treatment. Let's now talk about the effects of this condition. Excess menses can have significant effects on a woman's life. This statement rings true for many women who experience this condition. The impact is not limited to physical health, but extends to daily routines, emotional well-being, and overall quality of life. One of the most prevalent effects of excess menses is anemia. This condition arises when the body loses more blood than it can replenish, leading to a deficiency of red blood cells. Anemia often manifests itself through symptoms such as fatigue, dizziness, and a general feeling of weakness. It's like trying to drive a car with an empty fuel tank. The body just doesn't have the necessary resources to function optimally. In addition to anemia, excess menses often brings severe cramps along for the ride. These are not your average, bearable cramps. We're talking about debilitating pain that can make even the simplest tasks seem like an uphill battle. It's as if your body is in a constant state of rebellion, and the peace treaty seems far from sight. Then there's the disruption in daily activities. With heavy menstrual bleeding, planning becomes a crucial part of life. Whether it's a day at work, a trip to the grocery store, or even a quiet evening at home, everything needs to be planned around the menstrual cycle. It's like walking on eggshells, never knowing when the next wave will hit. Last, but certainly not least, is the emotional distress that comes with excess menses. It's a roller coaster of emotions that can leave you feeling drained. The constant worry, the stress of managing symptoms, the fear of public embarrassment. It's enough to make anyone feel overwhelmed. While these effects can be distressing, understanding and managing this condition can greatly improve one's quality of life. Remember, knowledge is power. The more you know about excess menses, the better equipped you will be to take control of your health and reclaim your life. Let's quickly recap what we've learned about excess menses. We started off by defining excess menses, also known as menorrhagia. This condition involves menstrual periods with abnormally heavy or prolonged bleeding. It's not just about getting your period, it's about how much you bleed and for how long. Remember, while it's normal for menstrual cycles to vary, excessive bleeding is not. Then, we delved into the causes of excess menses. From hormonal imbalances to uterine-related problems, there are several factors that can lead to this condition. We also touched on medical conditions like thyroid problems and certain types of infections that might contribute to heavy or prolonged menstrual bleeding. It's important to recognize that excess menses isn't just one of those things. It can be a sign of underlying health issues. Next, we discussed the symptoms of excess menses. These can range from heavy blood flow to menstrual bleeding lasting more than a week. Other symptoms might include the need to change pads or tampons every hour or two, or needing to double up on sanitary protection to control your menstrual flow. It's crucial to be aware of these symptoms, as they can help you identify if you're dealing with excess menses. We also explored the effects of excess menses. It's more than just a physical inconvenience. It can lead to anemia, causing fatigue and shortness of breath. It can also make it difficult to participate in everyday activities and may result in emotional distress or depression. Finally, we emphasized the importance of seeking medical help when experiencing these symptoms. It's not something to just put up with. There are treatments available that can help manage the condition and improve your quality of life. Remember, understanding your body is the first step towards managing your health. Stay informed, stay healthy.